Hi, my name's Hilary Bower. I'm one of the doctors here at Clinic 66. My background is in general practice, and I have a particular focus now on reproductive and sexual health. Today we're going to wander through contraception. So I'm going to talk about issues around contraception, in particular common myths and facts around contraception, and they're common questions that women come in and ask us about here at Clinic 66. It is a fact that the pill is the most commonly used contraception in Australia, followed by condoms. However, long-acting reversible contraceptive options such as IUDs and implants are increasingly being used in Australia and utilised in Australia, and they're very effective, longer-acting contraceptive options. So this one's a good statement to sort of talk through, and it's actually a myth. So even though the pill is used very commonly, it's a very good contraceptive option. It's not the most effective contraceptive option. So the most effective contraceptive options are those contraceptives that we call set and forget contraception. So we've got things like contraceptive implant, which is a rod that goes into the arm, an intrauterine device that goes into the uterus. So they're more than 99% effective at preventing pregnancy. Going down the scale from that to slightly less effective are those ones that need to be taken perfectly every time. So they're user dependent. They depend on you if you're taking the contraception. So for example, pills, you need to be perfect pill takers for it to work, extremely effectively. And then you've got least effective, generally barriers. So things like condoms, diaphragms, they're still good contraceptive options, but they're least effective in the array of the contraceptive options available to you. A lot of women come in and they ask about future fertility and whether contraception can affect future fertility, and this one's a myth. They're often concerned about the pill, being on the pill for a long time can affect fertility in the future, but there's no evidence to show that this occurs. And in fact, there's been a few studies about long-term fertility in the pill, and one of them shows that women who have been on the pill for a long time and they stop the pill, about 99% of those women actually start menstruating within 3 months or fall pregnant within 3 months. The only contraceptive option that can delay a return in fertility is an injection called Depo-Provera, and that can delay return in fertility for sometimes in some women for up to 12 months. Every time we prescribe the pill, a health provider, like here at Clinic 66, we do ask you questions about your general health and specifically go through any contraindications to providing the pill. And if you don't have any contraindications, there's no reason to have a pill holiday or stop the pill just to see how your hormones are going. There's no benefit to that, and if you don't want to be pregnant, it's important to continue with contraception. This one's true. So the combined pill can actually really help with acne. All pills help with acne, and some pills help better than others. And that's because a component of the pill reduces down the effect of something called free testosterone that we all produce in our body, which can cause acne. So the pill can actually be really useful to help with acne as well as providing good contraception. Mood in the pill, it can be a tricky one to answer. So I think there's no doubt about it that some women are very sensitive to hormones and they may have their mood affected by hormones, but there's no clear evidence to show that the pill actually causes mood changes. The evidence is just really lacking around that. And mood changes can be due to many different things. So it can be due to what's going on in your external environment as well, related events, and so forth. But if you are experiencing mood changes on the pill and there's no other issues going on, then also please come and talk to us about that, because sometimes trying different pills can actually relieve you of those side effects that can occur with one pill could be better for you than another one, but the evidence is lacking in terms of scientific studies. If you're one of those women that can get premenstrual symptoms, and sometimes that can exhibit itself as being a mood change. Some people talk about being snappy or irritable, sometimes depressed or low, and it can be a cyclical thing around the premenstrual time, then the pill actually can be really useful to help to stabilise that. Some women may not think that they are able to have an IUD when you're young or you haven't had a child because of the insertion or the risks of having an IUD, but in fact the risks are really low of having an IUD in, and it's a really effective method of contraception. Remember, it's more than 99% effective at preventing pregnancy. If you don't like it, it can be removed at any time. And it's a set and forget, so it can last for 5 years or 10 years depending on which IUD is inserted. So in fact the risks and the insertion procedure is generally fairly straightforward, particularly in a clinic such as ours where we are very expert, we're very experienced at inserting IUDs. You can have it inserted under sedation or while you're awake, and we certainly counsel you around that. So an IUD is available for women of all ages. This one's a fact, and I'm very excited to talk to you about a new IUD that has been introduced into Australia in March this year. So this IUD is called a Kyleena. It's a hormonal IUD, so it secretes a hormone that works down in the uterine area to stop pregnancy occurring, and it's really as effective as Mirena. Mirena you may have heard about, that's been around for many years. It lasts for 5 years, just like Mirena does. It can be removed at any time if you don't like it, or it lasts for 5 years, which is great. But it has less hormone in it than Mirena. So for those women that are concerned about hormones, it's certainly something to consider. It generally makes periods lighter, and sometimes women on Kyleena don't get any bleeding at all, which is fine. Most women are happy with having no bleeding at all. It's a tiny IUD, it's much smaller than the Mirena, so it's a little bit easier to insert, and the device itself is very small. So this is what it looks like. It's just a small device that sits inside the uterus. And it costs the same as a Mirena to insert. And we have inserted many numbers of Kyleenas here at Clinic 66, as well as other IUDs. This one's a myth. So Implanon doesn't cause bleeding all of the time for every woman who has Implanon inserted. But it certainly can change your bleeding pattern, your menstrual bleeding pattern. And how I describe it when I counsel women prior to having an Implanon put in, I sort of show them the fingers of my hand. So what I say is 1 in 5 women have no bleeding at all with Implanon, and that's fine because it makes the lining of the uterus so thin that there's nothing to shed. So 1 in 5 get no bleeding. 1 in 4 women can get daily bleeding and spotting, and that can improve over time. So it can take 3 to 6 months to improve. Sometimes it doesn't improve in some women. And what I generally say is, if you're having daily bleeding and spotting, come and talk to me about it. Sometimes we can give some medicine to just relieve it for temporarily, to keep the Implanon in for 3 months to see if it goes away of its own accord. So we've got that 1 in 5 women with no bleeding, 1 in 4 women with daily bleeding and spotting, and then we have 3 in 5 women who have an acceptable bleeding pattern. So some bleeding pattern that is acceptable to them. It may be a bit irregular, but it's acceptable. Implanon is such a good contraceptive option. It's one of those groups of long-acting reversible contraceptive options that are more than 99% effective, such as IUDs are part of that group as well. The Implanon sits inside just under the skin, under the upper arm, and it's a very simple procedure to insert. And we do this all the time here at Clinic 66. We used to call the emergency pill the morning after pill, so the morning after unprotected sex, but in fact, the emergency pill, there are two different sorts of emergency pill that are available, and you can just go to the chemist and get it. You don't need a prescription. So the idea of the emergency pills are to delay ovulation to prevent pregnancy. And it can be one type of emergency pill is registered for use up to 3 days after unprotected sex, and the other one is registered for use up to 5 days after unprotected sex. So there's two different options for emergency contraception, and it's not necessarily just available for the morning after, although the sooner you go after unprotected sex and take the pill, the more effective it is. And don't forget about the copper IUD. So if you've had unprotected sex in the last 5 days, it could be that you could have a copper IUD inserted, and that's a highly effective form of emergency contraception, which can then last for 5 to 10 years as ongoing contraception, and we can insert that for you here at Clinic 66. So today we've talked about some of the myths and facts around contraception. And contraception is something that we do every day here at Clinic 66. So if you're not wanting to fall pregnant and you're sexually active, it's important to consider contraception. So please come in, we can talk to you about all the different contraceptive options, and you can decide which contraceptive option would be suitable for you.